नमस्कार साथियों, मैं डॉक्टर लोकेश भाटिया स्वागत करता हूं आपका आज के इस वीडियो में। डियर फ्रेंड्स, टुडे आई विल बी टॉकिंग टू यू अबाउट अ टॉपिक, अ प्रॉब्लम which I was suffering till November, December, and I got my sleep analysis done and I was detected to having a full-blown sleep apnea problem. So I decided today to talk to you about what is sleep apnea. It's a problem which is worth understanding, worth making oneself aware about it, because majority people are not aware that this entity exists. Nobody will come ever and complain in doctor's clinic that I have sleep apnea, because they take it as that the person is only taking snoring and nothing else. Snoring is very comfortably, very easily accepted. People cannot figure out that this snoring can be even life threatening. So we should be aware about this particular entity, and this is called sleep apnea.
डिस्को किंग यानी बप्पी लाहिड़ी हमारे बीच में नहीं रहे। पिछले एक साल से वो ऑब्स्ट्रक्टिव स्लीप एपनिया की समस्या से जूझ रहे थे।
President Biden is using a device for his sleep apnea.
How many hours of sleep did you get last night?
Sleep is something so many people struggle with.
Up to 18 million Americans suffer from sleep apnea. Many of them don't know it. Now, a long-term study from the Mayo Clinic highlights the danger of this disorder.
अकेले भारत में ही स्लीपिंग डिसऑर्डर के 3.5 करोड़ मरीज हैं।
The study shows that people with sleep apnea have a higher risk of dying from sudden cardiac arrest.
Sleep is important because during sleep we consolidate our memory. When your sleep is disturbed, memory can be impaired.
The national average in Japan is 5 hours and 59 minutes. Saudi Arabia, 6 hours 8 minutes. Sweden, 6 hours 10 minutes. India, 6 hours and 20 minutes. Do you know these numbers can kill us?
So sleep apnea is one such problem which can compromise one's oxygenation while sleeping. Sleep apnea comes in majority of very obese people, and if you or someone of you are dealing with the sleep issues, this video is for all of you. We'll cover what sleep apnea is, what are the types of sleep apnea, what are the symptoms, what are the causes, and how to manage it effectively. What is sleep apnea? Sleep apnea is a sleep disorder that disrupts your breathing while you are sleeping. During sleep, the muscles in your throat and mouth relax, leading to a partial or a complete blockage of your airways. As a result, you may experience short pauses in breathing, known as apneas. These apneas can last from a few seconds to even minutes and can happen multiple times during the night. Types of sleep apnea. After understanding what is sleep apnea, let's discuss about what are the types of sleep apnea. So there are three main types of sleep apnea. Number one is obstructive sleep apnea. That is obstructive sleep apnea, that is OSA. This is the most common type, occurring when the muscles of the throat muscles are excessively blocking the airways. Number two is central sleep apnea. Unlike obstructive sleep apnea or OSA, the airway isn't blocked here in the central sleep apnea. Instead, the brain fails to send signals to the muscles responsible for controlling breathing. Third one is a complex sleep apnea, which is a combination of 1 and 2. As I said, the problem because of the muscles and the problem coming from the brain not sending the signals to. So this is a combination of the 1 and 2. That is a complex sleep apnea. So these are the three types of sleep apnea. Coming to the symptoms of sleep apnea. Symptoms, by and large, patient are not aware. So it can lead to several noticeable symptoms, including, which everyone should be aware of, loud and chronic snoring. to the extent the husband and wife might not be sleeping in the same room, same bed. Gasping or choking sensations during sleep. Excessive daytime sleepiness or fatigue. Many people complain that while driving they feel like doping, they feel like sleeping. Difficulty in concentrating. Morning headaches, memory issues, irritability and mood swings. So these are all the symptoms. What are the causes of sleep apnea? There are various factors can be contributing to sleep apnea and that can develop very frequently sleep apnea in any individual. Number one is obesity. Excess weight can increase the risk of obstructive sleep apnea as the fat deposits around the upper airway can obstruct breathing. Second contributing factor is age. The sleep apnea becomes more common as we age. The third one is gender. Men are more likely to have apnea than women. But it is not that women are not going to snore or not going to have sleep apnea. Women can also have it. I'm talking about more common. Fourth is family history. If you have a family history of sleep apnea, your risk might be higher. Fifth comes is smoking and alcohol. Both smoking and excessive alcohol intake and excessive alcohol consumption can increase the likelihood of sleep apnea. So if one is smoking and one is taking alcohol, should be aware about this particular entity. Next comes is medical conditions. Congestive heart failure, type 2 diabetes, high blood pressure are all associated with a high risk of sleep apnea. Like my cardiologist always emphasizes a lot of importance of getting sleep analysis done and checking for sleep apnea. So the importance of the diagnosis is if you suspect that you have sleep apnea or have noticed any of the symptoms as we have mentioned above, it's very crucial to seek a proper diagnosis. Sleep apnea left untreated can lead to several health issues, including heart problems, diabetes, and even accidents caused by daytime sleepiness. A lot of people you must have heard of that he doped and met an accident. Managing sleep apnea. The good news is there are effective ways to manage sleep apnea. Lifestyle changes. What are the lifestyle changes which can help to reduce the incidence of sleep apnea is maintain a healthy weight. Avoid smoking, avoid taking alcohol, establish a consistent sleep schedule. Sleeping positions are also equally important. Elevating your head while sleeping can help keeping the airways open. I've already made videos how to place pillows. You can check on my previous videos. Then continuous positive airway pressure therapy, CPAP. A common treatment where a machine delivers a continuous flow of air through a mask, keeping the airway open during sleep. That's very, very effective treatment. Even I also had taken for a very short period of time. Bi-level positive airway pressure therapy similar to CPAP but provides a different air pressure levels for inhalation and exhalation. Oral appliances, specially fitted dental devices that can help to keep your airways open. Next comes a surgery. In severe cases, surgery might be considered to remove excessive tissue blocking the airway. For example, in my case, the tonsils were very much inflamed and very common because of mouth breathing, the tonsils used to get inflamed very frequently. After my weight reduction, everything got sorted out. So consult a sleep clinic and always consult a health professional if you suspect that you have a sleep apnea problem, and they can provide you a proper diagnosis and recommend the most appropriate treatment for you. Weight reduction is number one. In my case, just by reducing my weight, the problem got sorted out. And after my weight reduction, after getting close to 80 kgs, things are got sorted out in terms of sleep apnea. So sleep apnea, conclusively, let's conclude this topic. Sleep apnea is a serious condition that affects millions of people worldwide. But remember, with the right approach and professional guidance, it can be effectively be managed. Prioritize your sleep health, because a good night's sleep is vital for overall well-being. If you find this video of value, if you find that it has enhanced your knowledge, give it a thumbs up, share it with your friends and family and in their WhatsApp groups, and make sure to subscribe to Lok Talks. Thank you very much. Bye-bye. See you next week.